Where do you come down on just fat in general? Is it important that people lower their polyunsaturated, monounsaturated fat content too, or is it just saturated and trans fats we should be looking at?
Well, I think it's individualized, honestly. And what is lost a lot of times in medicine, whether it's the typical Western medicine with medications or lifestyle medicine, talking about diet and such, is there is a lot of individual variability from person to person, how they respond to things. Just like we know that 30% of people are hyper responders when they go plant-based, their cholesterol numbers plummet. About 50% have a moderate change. About 20%, their cholesterol numbers only go down a much smaller amount. There's a lot of individual variability, and it's the same thing with the ability to tolerate higher fat in the diet. Obviously, we want to avoid the saturated fats, no question, and the more polyunsaturated, just the healthier fats. Eating there's fat in everything too. If you think about, I remember when I talk about should we be oil free, et cetera, you get people, oh my gosh, you need fats, you're going to die without fats. It's like, well, broccoli is 10% fat. People don't realize there's fat in everything. We just want to avoid being super high fat. And almost anything, even avocado and such, olives and nuts and seeds have some saturated fats in them. So when you think about a person's individual situation, if they have heart disease or stroke or some other vascular disease or are very, very high risk based on family history and risk factors, you're going to want to make sure that the fat content is low enough that you get your LDL cholesterol down less than 70 at least. And so you're doing good with reducing fat in your diet if your weight is good, because obviously fat is much more calorie dense and can lead to weight gain if you overconsume it. So if you're at your ideal body weight, if your LDL cholesterol is less than 70, and if your inflammation markers are negative, then what you're doing is right. And so we try to target those things. It's hard to achieve, perfection, but many people certainly can. So if you don't have heart disease, adding some healthy fats in there, some avocado and nuts and seeds, I'm okay with it as long as everything else looks fine. Your weight's good, your LDL's good, you're not having any inflammation in your system. So I think the Esselstyn diets and the Ornish diets, which a lot of people label as, more difficult to follow, they're a little bit more strict. Those are much more important for people with documented vascular disease or very, very high risk. But you could be a little bit, in order to help you maintain the diet a little bit better, in the long term, you could be a little bit loose with the fats as long as you're watching your risk factors and you're doing, your numbers all look good.
Mm-hmm. And lean into the whole fats. So a walnut instead of walnut oil.
Mm-hmm. Oh, of course. Okay. Of course. Yeah. You really want to avoid the processed fats as you can. Now, certainly we always think about things, what is the most harmful, what is less harmful, and what is ideal. Ideal is to get your fats from whole unprocessed plant-based foods. If there was going to be any oil in the diet, keeping the type of oil lower in saturated fats important. So olive oil, that's why olive oil gets such a lot of attention, is because it's only about 15% saturated fat versus coconut oil, which is 80 or 85% saturated fat, and palm oil very high in saturated fat. So canola oil is lower in saturated fat, avocado oil's a little bit lower in saturated fat. But again, it's still fat, it's processed, it's calorie dense. If you happen to be ideal body weight, your LDL is good, and you have just this very small amount of olive oil or canola oil, it's not going to be devastating to your health. But the problem is people think, oh, these oils are so good for me. They're like dousing everything with like tons and gallons of like olive oil all over the place. And then they're like, why am I not losing weight? Or why is my LDL still high? It's like, well, it's still a lot of fat and it's a lot of calories. It might be better. And I get it. It's confusing. When you look at the research and you look at the way that the scientific community even kind of portrays olive oil as being so healthy for you, it could be confusing. And when you look at the data and the research, a lot of the research that shows olive oil is good for you is really eliminating or what should I say, substituting olive oil for animal-based fats. So it's like saying, if you remove the beef fat and instead have olive oil, oh, look, you do better. You have fewer heart attacks, fewer strokes. Well, that's because you're dropping the cholesterol and the saturated fat content is lower. Does that mean olive oil is good for you? Or is it just simply less harmful for you than animal-based fat is? Now, if you had a part of that research study that had no oil and no animal fat, are you going to do better? Maybe for sure. And the funny analogy that I use for this is it's kind of comparing, if you have a research group and one side you give a bunch of cyanide and the other side you give a bunch of arsenic, and you go, oh, look, the people who are getting the arsenic, they're not dying so fast. Ooh, arsenic must be good for you, right? Because if you give cyanide, man, they die real quick. And so everybody's like, hey, arsenic's good for you. Well, not really. Arsenic's not good for you. It's just less harmful. It'll kill you slower than the cyanide will. And that's what we call a substitutionary benefit. You substitute one thing for another. You're substituting in these studies the olive oil for the beef fat or the animal fat, and you think it's better, but it's not really better. It's just less harmful. That's all.
Yeah.